This is a review because I will have this on the exam again. Some of you got this wrong. Diffusion is proportional to change in pressure times surface area times solubility over thickness times square root of molecular weight. So these two I'm not going to play around with for the test, but you will have to know how these affect diffusion. Diffusion related to these variables, like I said, if I have increase in thickness because there's too much water inside the lung, the water in the lung could be from congestive heart failure of the left side, it could be from pneumonia, it could be from pleural effusion. Doesn't matter what the cause is, the result is still going to be the same. If you have water in the lung, increased barrier thickness, the patient is going to start feeling like they cannot breathe. They have a decrease in oxygen diffusion crossing from the lung into the body. So now they're going to complain of shortness of breath, difficulty breathing, and dyspnea. How do you treat? Well, let's say immediately we can't affect the water that's in the lung. That might take a little while for it to resolve. So if they're really, truly having a hard time breathing, you give them simply an O2 mask. 2 liters nasal canalicula, whatever you want to call it. So I just increase the pressure of oxygen. So we call it an increase in PO2. That increases the amount of fluid or oxygen that can cross, and what happens to their symptoms and what happens to their complaints. It should minimize, right? They should be able to breathe. So their shortness of breath, difficulty breathing, and dyspnea should be alleviated. So first problem, second result, third treatment, at least immediate treatment option, and fourth is the final result of the treatment. Let's do that one more time. I have a patient that comes in, they're complaining of difficulty breathing, shortness of breath, etc. Upon examination, I discovered that they are a smoker of 40 years and they smoked 2 packs a day, so they have an 80-pack year history. There's destruction of alveoli when you have emphysema. That means there's a decrease in surface area. If you decrease surface area because you have destruction of alveoli, what happens to diffusion of oxygen? Anything on the top goes down, diffusion goes down. So I have a decrease in diffusion of oxygen. They start complaining of shortness of breath, difficulty breathing, etc., and dyspnea. How do I treat? Well, immediate treatment option would be to give them an O2 mask, right? They can't breathe. So increase PO2 levels, and what happens to diffusion of oxygen? Well, diffusion of oxygen goes up. So in the short term, you can deal with their difficulty in breathing. Long term, though, what are some options for long term? Yep, maintain the oxygen level. But we'll talk about some of the complications and problems associated with too much oxygen to a patient over time. Increased surface area. There is the potential to have a lung transplant. Not common procedure, but the potential is still there.